Hey guys, I am just now in this past month getting out of chronic sciatic nerve pain and back pain that was debilitating to the point that I was unable to play sports, jump, run, do any of the things that I love to do. So I am now able to record this video because I have joined back into a jiu-jitsu gym, and I'm able to be folded almost in half by other people without experiencing pain, which is phenomenal. Starting to get that functional mobility back, and I'm hoping that this routine that I'm about to show you will be useful for anybody that has the same set of symptoms as I do. This comes with a caveat of don't just try to YouTube your way out of this. I did that for months, I'd say, before then the condition getting worse and worse and worse to the point where I did start to see chiropractors, acupuncturists, and physiotherapists. And what I'm about to show you is actually the result of kind of cross-comparing what was common across all of those disciplines, what they told me to do, and then I adapted it and used it for myself. It so happens that I ended up responding best to physiotherapy, though I've also known friends who have had these types of symptoms relieved by osteopaths, by chiropractors, and by acupuncture. So it's really more to do with like how you respond to treatment and the individual practitioners, I think, more so than the name of, oh well, chiropractic works or physio is better. I would try not to think that way and instead just listen to your own body and see how it's responding to what you're doing, and that's going to be the best path to a full recovery. One thing to really keep in mind that I struggled with was the fact that this is a slow ship to turn around. Nerve tension, which is what I have and possibly something that you have, nerve tension is something that takes a long time to turn around and aim back toward recovery. And it takes daily, even if it's a short burst of rehab work, it is a daily thing. You do it every day if you can, if you're not in symptomatic distress. So let's start talking about what I was doing and what my symptoms were so you can compare them to your own. Let's see where the light's good here. Let's do something like this. So for me, my symptoms came on when I would hinge forward like this while raising the side that would cause some symptoms right in this region. And when it was at its worst, it would actually fire all the way down my leg. So I'm gonna see if I can show that a little better. So also it would come down my leg and into my ankle and on the outside of my foot. So at my worst, I was in bed for 4 straight days, fluctuating between a 7 and a 9 out of 10 for pain. I got medication. I was taking naproxen to try to sleep through the night. I would go to sleep at 9, I'd wake up at midnight, and then I'd be in pain from midnight until 6 a.m., just unable to sleep. So the pain was quite intense, and I'm hoping that you're not in that same situation. But let's start talking about what can be done if you have these same sort of sciatic symptoms, possibly some nerve tension that comes on when you do that forward hinge, when you bring your chin to your chest and kick your leg up. Just kind of hard to capture some of this on camera, but when you go chin to chest and then a leg raise, if that's causing crazy symptomology for you, or I don't know if that's a word, but try some of these exercises because they did wonders for me, applied very, very, very gradually and gently, and increased in intensity over time. So the first one is planks from the knees. And I've been doing various exercises my whole life, and I kind of felt a little ridiculous doing this at first, but I'm glad that I started so gently so as not to aggravate the injury. So I'm literally doing this plank from the knees, holding for maybe 10 to 20 seconds, and then resting in baby cobra. Both of these things were quite helpful for me to get into this extension for the baby cobra. And also light strengthening, and my physiotherapist called that a rebooting of the muscles that I suppose had shut down in order to protect the injury. So what he was trying to describe to me is that the muscles, you need to get them back online, and these gentle rehab exercises, they're not meant to like build, necessarily strength and power or performance. They're more about firing signals through those muscles again, getting those fibers that have gone to sleep to wake up and start to do their job again, and not avoid those normal movement patterns that will reverse you out of the injury process. So this is all like, this isn't medical advice by any means. This is kind of me giving you the experience and the information from the patient's perspective. This is just what I've retained as best I can. It's probably not very accurate. You're gonna want to fact check all this, but you're gonna do your planks. When you're very comfortable and have been doing this for 1 or 2 weeks, get up to your toes. So when you're good from here, go to your toes. Don't skip the 2 weeks from your knees. We want to be real gentle, real gradual. And then get to your toes. And when you've done about a week or 2 on your toes, you're going to graduate to the final one, which is leg raises. And you're really focusing on engaging your glute, contracting, lifting, trying to keep your pelvis stationary in space. And we're just doing maybe 10 each side. And I do those every day preventatively now, and they've been amazing for me. I just focus on getting my glute engaged, gentle leg raises, get some blood through that area, get those muscles firing. Especially if you do a lot of sitting, it's nice to get those going in the morning. The next thing I've been doing is, and this might be quite painful for you, it was for me, is these deadlifts. Where should I do this? Let's try this. So I've got a 10-pound kettlebell. You can use a backpack if you don't have any equipment at home. I'm just holding something that's going to give me some resistance. I'm doing a sort of deadlift here where I'm hinging at the hips and just feeling the symptoms come on lightly in my right side. I'm coming up nice and slow from the side, hinging at the hips, and back up. If you've done that for a week or 2, you can switch to single leg, more reps, or slightly more weight. The weight is not the important thing. It's the reps and the range of motion. Got my alarm going off here. I'm just going to dismiss that. Okay, so I'll demo those 2. So now we've got single leg. So I've got it in front of me like this. Again, trying to hinge at the hips and up. Maybe 10 each leg. Hinging at the hips and up. That's nice for the ankles too, get the mobility in. Same on this side, I'll just give you the side view. Hinging at the hips and up. Nice and controlled. We want to go nice and controlled for all of this. It's so hard to resist, like as someone who's worked out for more athletic goals, it's so hard to resist going harder, going faster, going more explosively, going heavier, going for more reps. Just resist all of those things. This is physio rehab we're doing. So it's just gentle range of motion stuff. We're just getting blood through, we're reactivating and rebooting muscles. So we've got the deadlifts covered, we've got the plank covered. Now we're gonna hit the most important part, the flossing, nerve flossing. You're gonna have seen this in every video worth its weight in salt or maybe gold online, because videos don't weigh anything, so you can have it worth whatever weight you want. So nerve flossing, let's see if I can get my whole body in here. Nerve flossing is addressing the shortening of the nerve. So my nerve had shortened. I have nerve tension on my right sciatic nerve. So for me, kicking forward with a tucked chin was very uncomfortable. And in fact, I have some symptoms right now, so I'm feeling it about here. And in order to floss this nerve, you can start to move the nerve through your spine and pelvis by tucking your chin, pointing your toes, and very slowly going the other way. And if you put your hands behind your back and slouch forward, you're really going to feel those symptoms come on and off as you floss. The suggestion is to do this from something a bit higher where you're able to actually swing and hinge. So maybe like a kitchen counter, or maybe a piano bench, or even a kitchen table, something where you can have your legs hanging a little better. So that swinging process is a bit easier. And then once you have been doing a lot of nerve flossing, you can actually do some nerve stretching, and that's where you would get your foot up on something like an ottoman, or I've got this kid slide here. And in this situation, let's see if I can get my head in there too, because the chin tuck is important. So in this situation, I've got my foot elevated, and now I'm going to put my nerve under gentle tension with a tucked chin, slouched upper body. I'm going to tension the nerve by bringing my toe toward my knee, we'll say. And this is going to stretch that nerve and help bring some of that length back. So in terms of, how intensely should you do this? Not very intensely. How long should you do it for? Maybe a couple minutes at a time. Maybe once a day to start, and if you're finding the next day you're not symptomatic, or if you see some improvement, you can gently increase. I've been seeing physio for maybe 10 weeks, and next week we're going to assess to see whether I need to come back at all, because he thinks that my progress has been such that I've improved to the point where I'm not going to need any kind of treatment. I can just stay with these exercises. Now, the last thing I want to mention in this video is there's probably a piece here that you won't be able to get without seeing a specialist, and that is, for me, the actual joint manipulation. So my physio would actually get me on my side. He would underhook my arm at the elbow, and he would apply his upper body weight from his elbow right into my pelvis, right into my hip, basically. And he's at this whole process, he's kind of like feeling in around my spine. He's looking for creating some expansion in the joint that for me was problematically compressed into the nerve. And that always produced quite a lot of relief for me. So in terms of like, is it worth spending the $80, $100, whatever it is in your area for some treatment? To me, it was very much worth it in combination. And I'm paying out of pocket. Like I don't have any benefits. I'm working from home. So for me, it's like I'm paying cash for this. Still very much worth it, because that expansion of the joint he was able to do, and like he would do that, he'd hold it. The joint itself probably benefits massively from having that expansion, which is really tough to do on your own, I think, especially safely. So that's the one piece to this puzzle that you won't be able to get by doing it yourself with a YouTube video. You want to get somebody to help actually address that joint. Other than that, if you can do those planks every single day, your very gentle deadlifts with the purpose of increasing range of motion with the assistance of some light weight, and then finally, but most importantly, the nerve flossing and nerve stretching. Gentle. The whole thing, everything about it, gentle. Just invest in the process, get the reps in over the long term. You will see those symptoms diminish, especially with the assistance of a professional. Throw your comments and questions in below. I don't know much about this, but I think the community is pretty strong online. People can start to jump in there, especially people who have accreditation on these types of things. Physiotherapists, people who know what they're talking about can talk about it. And then as for my experience, I can speak to that directly. So good luck, guys. And I know what the pain's like. It's horrible, so I feel for you, and best of luck.